I'm Becky Noyes from Thomas More, pharmacist and lecturer in nursing education. I'm presenting on behalf of the Primary Care Academy. The topic of my presentation is powerful learning environments. It's a call to action for undergraduate health and care education to meet the needs of primary care. I will highlight some important aspects to consider when you are designing future-proof education. The key role of primary care can no longer be ignored, and is becoming an important workplace for future health professionals. Therefore, we must reconsider the approach to training students to face the challenges of primary care. While our healthcare system is in transition from an acute to a chronic care model, powerful learning environments can help to make this transition. In a needs assessment conducted by the Primary Care Academy, patients expressed the desire to be treated as a person, with respect for their autonomy, and focus on what they really want and need for a meaningful life. Therefore, training of care professionals should include communication and coaching skills, as well as collaboration and coordination skills. An educational scan assessed that important themes such as self-management support, goal-oriented care, and interprofessional collaboration were insufficiently embedded in the higher education curriculum in directions of care and welfare. These findings highlight a gap between education and what is needed in primary care. Students need practice in proactive, person-centered, and community-based integrated care, where they learn to collaborate with other professions. How did we identify these powerful learning environments? In the first phase, we identified the key elements. We wrote the strategic notes based on the needs assessment and the educational scan as mentioned before, and on educational models like high-impact learning and interprofessional education. We invited educational experts to share their ideas and suggestions on powerful learning environments. This gives us insight as to what makes a powerful learning environment and which competences need to be integrated. Next, we identified good practices in Flemish educational institutions. For this, we searched the data in the educational scan and interviewed the responsible lecturers. We invited teachers from the European Qualification Level 5 in Flanders to join us for an inspiring workshop. And we asked partners from the Primary Care Academy to share examples of powerful learning environments. In addition, a survey was conducted among final year students about their most powerful learning experiences in their educational program. And finally, we are conducting a literature review to detect good practices internationally. We aim to write a position paper with a call for action to bridge the gap between education and the needs in primary care, and develop an inspiration guide sharing good practices for curriculum developers. The key elements of a powerful learning environment that we identified are the following: offering an authentic and complex context, applying a mix of didactical methods, and evaluating in an integrative and reflective way. First, the context. Authentic learning is real-life learning. Authentic learning is rooted in real-world context and has a high ability to transfer theory into real-world settings. Students engage with these problems and experience they make sense in practice because they create useful products to share with their client. Prior knowledge is activated and new knowledge is constructed. Next, the learning activities. A mix of didactical methods to transfer knowledge, skills, attitude from theory into practice, and to develop higher learning skills listed from simple to complex. A chance for the learner to reflect on his actions and to have informal context in addition to formal learning moments. So the students are responsible for their own learning process and stay motivated. And last, evaluation. Integrative and reflective evaluation of both process and product, whereby approaching reality as closely as possible. The learner must be recognized in what he already knows and can do, in order to remain motivated and to steer the evolution process in the right direction. What are the goals we want to achieve with powerful learning environments in primary care? Our aim is to inspire higher educational institutions to implement education focused on primary care and to prepare students in Flanders and Brussels for a strong and complex primary care in an effective way. The skills and competencies we want to achieve are organizing patient education, coaching, enhancing empowerment and shared decision-making, problem-solving skills, communication skills, coordination skills, and interprofessional collaboration and co-creation. In implementing powerful learning environments, we recommend the following. Instead of a one-shot learning activity, develop a learning trajectory throughout the training program. Start from on-campus activities in a safe environment and move into the community in collaboration with care and welfare organizations. Start with activities within the discipline and gradually move to interdisciplinary collaboration. Always start from real-life situations. Initially, this can be case-based, but evolve to working with the patient in their home situation. And develop from simple to complex learning situations, from a focus on one problem to an holistic approach. To give you a more specific idea about powerful learning environments, I select a few good practices. For example, case-based learning like IPSIC and LISA, where students from different institutions and disciplines work together for 1 week. They develop an interprofessional care plan and discuss about ethical issues. At Hoogent, there's an opportunity for interprofessional internship at the residential care center. The students in nursing, speech therapy, social work, occupational therapy are tasked to develop achievable interprofessional care goals using the ECF framework. And for integrated care at Thomas More, a nursing student is assigned to a person with a long-term nursing problem in a socially vulnerable situation and must coach and encourage health-promoting behavior for 8 months. In LifeLab of VIVES, an interprofessional team of students works together with professionals around the resident's real-life problem using the ECF framework, and the team consults with the resident and provides support. To conclude, powerful learning environments can bridge the gap between education and needs in primary care. Integrating this approach in the current curriculum is urgently needed and can be done in stepping stones. The key elements to consider are an authentic and complex context, a mix of didactical methods, and an integrative and reflective evaluation. So, what are we waiting for? Let's hit the road together.